Gonococcal arthritis is caused by infection with a gram-negative diplococcus called Neisseria gonorrhea, same bacteria that causes the sexually transmitted disease, gonorrhea. Although the pathogenesis of articular involvement is controversial, gonococcal arthritis is ultimately a consequence of disseminated gonococcal infection. And it is a form of an acute septic arthritis. Gonococcal arthritis manifests as one of two clinical entities. The first, which occurs in about 2/3 of patients, is essentially a bacteremic syndrome, which includes skin rash, migratory arthritis, and tenosynovitis. The arthritis in this form of gonococcal arthritis is usually asymmetric, and it's polyarticular, and it's migratory, and for the most part involves the hands and feet. That is to say, patients will present with having a swollen finger one day, and then that resolved, and it was a swollen finger on a different hand the next day, and then one of the toes became swollen, and it resolved, and a different toe on a different foot became swollen, and that resolved. In addition, they'll have a rash and tenosynovitis, which is inflammation of the point where the tendons insert into the bone. About 1/3 of the patients with gonorrhea arthritis will present just as the case we just discussed, with a septic monoarthritis, most commonly involving the wrists. Patients with gonococcal arthritis usually require initial hospitalization for IV antibiotics, since ultimately this is a disseminated bacterial infection. Upon improvement, they can be switched to oral antibiotics. The typical treatment regimen includes IV cefotaxime or ceftriaxone, plus doxycycline, which is given to everybody with disseminated gonorrhea to treat possibly concurrent chlamydia as a public health measure. Interestingly, unlike Staph aureus septic arthritis, gonococcal arthritis rarely is associated with joint destruction and therefore is not really a surgical emergency.